Hello, my name is Ash, a counselor in training. This is my Relatable study podcast for individuals who need help studying for their NCE, CPCE, and other related counseling exams. I'm going to go through many questions from multiple resources and make the answers relatable to both you and me. So get your listening ears on and let's get studying. What is the purpose of the Minnesota Multiphasic Personality Inventory 3, MMPI 3? The Minnesota Multiphasic Personality Inventory 3, MMPI 3, was developed to diagnose psychiatric patients through an altitude of the examinee towards the tests would indicate by their scores on various validity measures. In general, these validity scores can be grouped into 3 measurements: those that defect inconsistently with non-response or responses, those that detect exaggerated self-reporting of severe or prevalence of psychological symptoms, and those meant to detect the underreporting of psychological symptoms. I would recommend looking into the MMPI 3 examples because there are plenty of out there and they are too long to read in this short form podcast. When working with a client who is experiencing alcohol withdrawal, which of the following symptoms is most critical to recognize and address immediately due to its potential severity? A. Mild anxiety and irritability. B. Intense craving for alcohol. C. Symptoms of delirium tremens, such as severe confusion and hallucinations. D. Temporary feelings of sadness and low mood. The answer is C. The most critical symptoms to recognize are symptoms of delirium tremens, such as severe confusion and hallucinations. These can lead to serious and dangerous changes in the brain, which regulates circulation and breathing, and the body's vital signs such as heart rate or blood pressure can change dramatically and unpredictably. That can create a risk of stroke, heart attack, or even death. The answer is C. Symptoms of delirium tremens, such as severe confusion and hallucinations, are the most critical to recognize with alcohol withdrawal. What is maturationism development theory? This theory is the viewpoint of development that is primarily driven by biological growth and genetic factors. An example of this development theory would be object permanence. It is like playing peekaboo with an infant. You're there one moment and gone the next. Co-leadership. A. Is helpful when one leader is experiencing countertransference. B. Exacerbates the harm of countertransference. C. Has no impact on the issue of countertransference. D. Eliminates all difficulties associated with countertransference. The answer is A. Co-leadership is helpful when one leader is experiencing countertransference, because if one leader is having an issue that is unresolved and is having a negative impact on the group, then the co-leader can deal with this particular issue or person and provides a second role model for participants. Transference refers to the client's issues being put on the counselor, whereas countertransference is when the counselor puts their problems or issues on the client, which interferes with the treatment process. What is the Mini Mental Status Examination, MMSE? The Mini Mental Status Examination, MMSE, is an assessment tool that can be utilized to systematically and thoroughly assess mental status. It is roughly an 11-question measurement that tests 5 areas of cognitive function, which is registration, attention and calculation, recall, orientation, and language. The maximum score is 30 for this test, and the score of 23 or lower will indicate some sort of cognitive impairment. The MMSE usually takes 5 to 10 minutes to administer, and it is useful to use repeatedly and routinely. With the older generation, it is used to evaluate for presence and severity of dementia and consists 20-point questions that evaluates immediate and short-term memory, orientation, recall, arithmetic, and the ability to follow simple commands and other functional abilities. That is all 5 questions for this episode. Thank you for listening. Keep calm and study on.